So as we saw lots of action at the White House today, what's your reaction to President Biden's first full day on the job?
Well, honestly, he made it very clear from the moment he campaigned for this position and luckily has received, the American vote in favor of a contested election, that pandemic response efforts were going to be the top priority. And today he started delivering on that promise for American people, signing multiple executive orders, implementing the types of things that we anticipated a heavy federal administration response could do. And that's starting literally at this moment in time.
And certainly starting at the top, there are notable differences in the way the Biden administration is approaching health and safety within its own ranks. What's your comment on that?
Well, that's a great point. One of the things that we're seeing very clearly and extensively is, first of all, accountability at the federal level first and foremost. That mask wearing will be essential, that testing, that vaccinations, that other initiatives that we would anticipate Americans participate in will be requirements for federal officials, federal agents, federal buildings, and all federal contractors. What does that basically mean and tell Americans? It tells them we're serious about treating and responding to COVID-19 in real time because federal officials are doing the very same thing. It was not what we necessarily saw in the prior administration.
Now let's talk strategy. What have we learned about the way the Biden administration plans to approach not just vaccine production, but distribution efforts?
It's a great point. One of the critical things is, I think, that we have to attribute to the Trump administration successfully is the development of vaccines. That's a really great achievement in such a short order. And to have two federally authorized vaccines available and more in the pipeline soon has been a fantastic initiative. But as multiple persons have reported, and you all did just momentarily, distribution is so critical. So can we better distribute vaccine in the United States? You bet we can. And President Biden's got a reasonably strong plan for how to sort of move that up front. It includes, for example, a lot more reliance on actual federal authorities and agents to actually make those distributions possible. He's going to open 100+ federally supported vaccine clinics across the United States in a lot of places where we don't even have available clinics within our state and local systems. That's a big plus. And to be sure, there's going to be a major national push for expanding vaccine production and manufacturing through any legal mechanism possible to make sure that those 100 million doses get into 100 million Americans in the near future.
Now, coordination is certainly key. I mean, this is a stark contrast to what was happening with the previous administration's rollout. So what do you see as the biggest hurdles to Biden's new efforts and how long it might take to really get all their systems in place?
It's a great point because one of the things we clearly see is at least a president admitting to American people early on, this is going to take time. This pandemic is that profound and that severe. But also, simultaneous to that sort of announcement, you saw the creation of a federal task force and a federal COVID sort of czar or overseer that will make sure that federal agencies that might have been scattershot in their approach before about what responsibilities they have or what they specifically should be doing will be fully coordinated across the federal system. Now, we all know the federal government in the United States has considerable resources to work with, and President Biden is seeking more from Congress. Once you equip this entity at this size with those powers and coordinate those initiatives through additional funding, I think we will see really magnanimous efforts done and real-time improvements for public health.
And speaking of funding, a lot of people are still wondering what's happening with the next phase of stimulus checks. Do we have any idea about the latest timeline for getting economic relief to American people?
Yeah, that's so essential. One of the things all Americans are feeling in every state is just the economic repercussions of this condition. It will only get worse in 2021 if we don't come to terms with the public health consequences. But as far as getting checks in the hands of Americans needy because, first of all, they face everything from unemployment to evictions, is essential. And I do think what you're seeing in regards to what President Trump signed late in December are infusions of new resources into Americans' pocketbooks soon. President Biden is promising $1,400 of extra additional payments for needy Americans in the near future. If Congress buys into that, I think Congress will. It knows now at this juncture this administration is serious about assuring economic stability for the United States, and that means economic stability globally.
So to that point then, how do you see Biden and the new Congress really working together to find common ground on some of these eligibility requirements and priorities when it comes to the stimulus? For example, certain income groups versus targeting those who've been left without work because of the pandemic.
Right. I mean, nobody's proposing in Congress or I think within the current administration that we're going to be handing out checks to wealthy Americans who are faring just perfectly fine in regards to the pandemic. But the hundreds of millions of Americans at some risk because of unemployment, because of the loss of their own businesses, eviction related concerns. I think everybody now agrees those Americans are entitled to some level of relief as we expect them to continue to socially distance, to keep their businesses shut down for periods of time. And you know what? That's something that President Biden has a very strong history negotiating within Congress. You got to remember, he was vice president to President Obama. And President Obama and that administration faced two epidemics, one with Ebola in 2015 and the H1N1 pandemic in 2009. They know how to negotiate out of this. None of those necessarily led to the same degree of sophistication or significance as COVID. Nothing's matched COVID. Let's be clear on that. But the tools and the messages and the approaches for how to actually get from Congress what's needed, I think this administration's got the right stuff.